What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last full prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Echo, tell me a joke.
What did the Terminator say to his last sip of coffee? Hasta la barista, baby. I was going to tell you a dirty joke, but I don't want you to soil yourself. Why did the cat cross the road? Because the chicken had a laser pointer.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
You give me the respect that I'm entitled to!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott. Traditional Chinese medicine provider gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM and visit our website, drsteve.com, for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Check out stuff.drsteve.com, stuff.drsteve.com for all of your shopping needs, particularly Amazon. It really helps a lot. And, it's been dropping off. It's okay. We appreciate everything that you all do. If you go to stuff.drsteve.com and just click on, go to Amazon, you can just go there and just skip over. It's just a way station. Otherwise, you can scroll down and get the Rody robotic tuner. There's a discount on that now. It's the greatest gift that you could give to someone who has a guitar habit, but also is under $200. Yep. And they have a new thing called the Rody Coach that'll actually teach you how to play your instrument, which I can't wait to see how that thing works.
Yeah, that'd be cool.
Check out ed.drsteve.com for the Phoenix Acoustic Wave Penile Restorative Thingamajig. And it's clinically demonstrated to have a significantly statistical response in improving erectile dysfunction in men who don't have some neurologic deficit. So check that out at ed.drsteve.com. And Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. With the best CBD nasal spray in the world, as far as I'm concerned. And Tacie and I have a show on Patreon called Weird Medicine, the Special Edition. Check out patreon.com/weirdmedicine. 100% of phone calls that are called into that get answered. And a little bit different than the regular thing where I have a backlog of thousands of questions we've just never gotten to. And I'm sorry for that if we never did. I try to answer everybody in text message. I fail in that regard sometimes too. But anyway, patreon.com/Weird Medicine. We've had Pete Davidson on. We had the Troika of Opie and Anthony, Mark Normand, Chad Zumach, and other folks like that. So it's been a fun thing. Oh, and Gino Bisconti, don't miss that one. Good Lord. You remember that, Tace? Mm-hmm. That was fun. Gino is childlike without being childish, and he is very animated, to say the least. So check that out. Patreon.com/Weird Medicine. And then if you want me to say fluid to your daddy for Father's Day, it doesn't quite have the ring of saying fluid to your mama. But anyway, if you want me to give your dad a Father's Day cameo, I dropped the price to $5 just because I like doing them. And all the proceeds go to ham radio. So,
oh my!
All of them.
And when you do a $5 cameo, I get like $3.
Yeah.
But it adds up.
It adds up.
We're my buddy Dale and I are saving up to create a moon bounce ham radio setup where we can actually bounce signals off the moon and talk to people that way. And I'm very excited about that.
Oh my God, it's amazing.
Yeah. All right, very good. Well, welcome back, Dr. Scott. Last week you were under the weather.
First time in how many years that I've not answered a bell?
Yeah, it's been a long time.
Yeah.
So you thought you had an adenovirus. Why did you think that and not, the more typical thing?
The C word?
Yeah, the C word. Right.
I just felt like it was
the virus that shall not be named.
Yes, it was mostly sinus and headache and runny nose.
Okay, so you're just making stuff up then.
Pretty much.
I mean, it could have been rhinovirus, right?
Yeah, could have been rhinovirus. Yeah, it got into my chest a little bit, but no color.
We were talking about how now, because of COVID, we have these respiratory virus panels now that we never had before.
Okay.
When people would come into the hospital with a non-bacterial pneumonia, we would just say it was
it's virus.
Yeah, it's a virus, atypical pneumonia.
Yep.
Now they have these viral panels, and one of the viruses they're looking at is rhinovirus. Huh. It's just a cold.
Yeah.
I mean, it's a rhino
cold.
Meaning nose. It's a nose virus.
Before COVID, it was a common cold.
It was just a common. That's right. And so we had somebody come in one of the remote hospitals. And they were like, "Oh, you better glove up and gown up in there because they've got rhinovirus." I was like, okay, just because it shows up on a lab test doesn't mean it's anything that we really need to be concerned about. I mean, I don't want to catch the guy's cold, so it's good to know, but. Yeah. It is. This is a new era, and this is the first step in fighting these fucking viruses, human pathologic viruses. This is the first step to finally pay attention to them.
Yep.
Now we notice you, and now we're going to come after you, and we are going to kill you.
Let's hope so.
Yeah, we got to.
Yeah, I felt a little rough. A little bit rough.
I think that's just as important as cancer. I mean, human virus, bird flu is one of those things that could really take out a bunch of people.
Oh, heck yeah. Or Ebola, if Ebola somehow shifts. And
if Ebola shifts to where it's...
doesn't kill you in the first 36 hours.
That's right.
Yeah.
That's right. We like I mean, we like it, but Ebola is reasonably workable because... It doesn't have asymptomatic carriers, and people are symptomatic quickly, and they die quickly, and so you isolate that area. And I mean, Nigeria really was one of the hallmark places that got an Ebola breakout and just dealt with it.
Yeah, jeez.
And did a really good job. So
What's interesting?
Yep, very good. All right, check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. All right, and Tacie, do you have any topics today?
Of course I do.
Oh boy, okay, well here we go. It's Tacie's time. All right, just do it. It's fine. You don't need it.
Well, hello, everyone.
You need the intro. I just really need to redo it. It's obnoxious.
I love it, yeah.
Topic number 1.
Yes.
Scientists find big cause of deadly pancreatic cancer.
What?
This is from No Ridge Science Report. Pancreatic ductal adenocarcinoma, or PDAC, 8% survive 5 years after diagnosis.
That's a bad one.
Yeah. When genes in the cancer stem cells were studied, they found a protein called CD9. It was on the surface of the stem cells. This protein could not act as a marker, but it also helps cancer stem cells behave in harmful ways. When changing the amount of CD9 in mice tumor cells, the tumors were formed smaller. Increasing CD9 made the cells more aggressive, and large tumors formed quickly. Patients with higher levels of CD9 tend to have a worse outlook. CD9 increases how fast cells take in glutamine, which helps the cancer grow. Cutting off glutamine is like starving the cancer.
So this gives them a target for future research.
Which is very much needed.
Absolutely it is. Pancreatic cancer can kiss my ass, like all cancers.
Yeah.
But that one, we usually don't find out about it till it's pretty well advanced, and that's the problem with it. So, that's actually very exciting. So, what I'm looking at is the original article in Nature's Cellular Biology, Natural Cellular Biology. CD9 identifies pancreatic cancer stem cells and modulates glutamine metabolism to fuel tumor growth. So that's very exciting. Somebody's going to make $1 billion off of this.
Let's hope
by developing.
Yeah.
Well, yeah, good.
Heck yeah. Get all power to them.
You take away the
terrible one.
That advantage, and if you just have the humanitarian advantage or altruistic outlook, you'll get it done eventually. It'll get done a lot faster if they can make a shitload of money off of it. So anyway, very good, Tace.
All right. Topic number 2. This comes from Reuters.com.
Okay.
Bayer says drug research focus will...
Bayer?
No,
Smokey the Bayer?
Suck
Bayer.
it. Suck it. Did you understand that?
Daniel Boone killed a bar.
Suck it.
Okay.
No longer on women's health. Bayer... makes Yasmin and Marina birth control. Said it would still continue to pursue the development of non-hormonal menopausal symptoms.
Oh, wow. Good for them.
They have a compound called elinzanetant as one of the 4 most promising pharmaceutical products. Again, you can suck it. The change is coming at the top for Bayer in June. CEO Bill Anderson will have to deal with lawsuits about Roundup killer causing cancer. Underwhelming drug pipeline and investors are looking for a change.
Yeah.
Bayer acquired Sharing, which had a large women's health business, and they will now focus on oncology, cardiovascular disease, neurology, rare disease, and immunology, which I feel like is where all pharmaceutical companies are going.
Immunology, yeah.
And rare disease.
Women have gotten the short end of the stick in medical research for
ever
decades. It was a lot of times, the medical schools were male, particularly in the 50s, and they published scientific articles based on male subjects. Even if they were animal subjects, they were very often male animals. And they would, you're going to ask questions that are interesting to you. So that's why we have a pill. We've got multiple pills and devices and shock waves and all this stuff for men's erectile issues, and not so much for women's libidos, because for them, who cares, right? I mean, that's the way the science is going.
That's what it looks like.
That's right. Oh God, Tacey's been watching the Duggar
documentary.
Good
Yes.
Lord.
Oh, was it terrible?
But anyway, yeah, and the thing is, we have to acknowledge this, that certain diseases impact men and women very differently. There is a difference.
Yeah, oh, yeah.
And we have to start putting as much. We need a Title IX for medical research the same way we need it for sports back in the 60s and 70s.
Yep.
You know, to make sure that we are paying attention to diseases that affect women. Now, one of the greatest advances, and we'll have to say that this is very important, is the Gardasil vaccine, because we are seeing already, I mean, if you've ever seen cervical cancer, particularly in its late stages in a young woman, it sucks. It's so bad. Mm-hmm. And the Gardasil vaccine, we're already seeing a reduction in abnormal pap smears. And I'm convinced that in the next decade, we're going to see a huge drop-off in deaths from cervical cancer.
It's wonderful.
So,
because that vaccine, the Gardasil's not that old, is it? 10 years?
Yeah, I don't know when it came out. Yeah, something like that.
Yeah.
The generation that got it in grade school are now
adults.
Now getting pap smears and stuff.
Yep.
Yeah, look that up if you don't care. All right, good one, Tace.
Great one, Tace.
Okay, topic number 3. Early heart attack symptoms missed the most often. This comes from the very scientific Parade magazine.
Okay.
Heart disease is the leading cause of death in the U.S., and most commonly missed, shortness of breath, can occur with or without chest discomfort.
Yep.
We're talking trouble breathing or dyspnea. I have trouble saying that.
That was perfect. Mm-hmm. Dyspnea.
Other commonly missed symptoms: chest pressure, upper abdominal pain. Don't wait for left-sided chest pain.
Right.
Also pain in the shoulder, arm, neck, on your back or stomach. Nausea, vomiting, heartburn, dizziness, sweating, and fatigue.
When my dad had his treadmill, this is way back before they had the nuclear treadmills that they do now. Mm-hmm. He just did a normal treadmill with an EKG, and all of a sudden they started seeing what we call ischemia, where there's one interval that starts to depress. And they were like, hey, you're having lack of blood going to the arteries in your heart and consequently to the heart muscle. And he said, well, that's weird. I'm not having any chest pain. I'm having pain in my left shoulder. And I always thought it was arthritis when I was out on the golf course. So he's out on the golf course having angina, heart pain, and thinking it's just arthritis because he didn't present like a textbook. Right. The textbook presentation for heart attack is left-sided chest pain radiating to the left arm with shortness of breath, palpitations, nausea, and sweating, or what we call diaphoresis. Almost nobody presents that way. When they do, it's easy.
Yeah.
So really, you could almost have a 12-year-old trained to pick that up if somebody comes in that way. It's the ones that present like Tacie is talking about, where they don't present in a textbook fashion. But what is almost always true, Tace, is these symptoms are associated with exertion. So I go up the stairs and all of a sudden I'm having shortness of breath every time. Or I walk up the stairs and I'm sweating, or I get nauseated, something like that. If it's associated with activity and it's reproducible, it's very likely, it's likely that you need to see somebody to get a workup.
Make sure it's not your heart.
Yeah.
Right?
Yep.
Yeah.
Okay.
I believe my aunt, she was having a widowmaker, and her main symptom was nausea and vomiting.
Yeah.
So she went to the doctor, and of course they did not catch it.
Yeah, well, you won't. I've told the story on this show multiple times of the guy that got triaged from the emergency room because he came in saying he had a sore throat. And what it really was, he was having a heart attack, and the pain was radiating up into his neck. And if he had said, I have neck pain, maybe they would have, but probably not even then. Now, if he said, I'm having neck pain with shortness of breath, that started when I was exerting myself, maybe they would have caught it. But, they put him in a room and pulled the curtain, and we'll get to you in a little bit, because they thought he had strep throat or something, and walked in and he was gone.
Dang.
So
also the lesson on that is when you go into the emergency room, be as specific as you can. Don't minimize your symptoms. Tell them everything.
Yep.
Okay.
Yeah. So I didn't think it was right to talk about symptoms without talking about prevention.
Okay.
And these are pretty, commonly known. But, healthy weight, physically active, eating healthy, not smoking, don't drink too much, sleep 7 to 9 hours a night.
Yes, Dr.
And manage
Steve.
your stress. I know, exactly.
Fuck off with managing stress.
Know
and
your
sleep.
blood
And
pressure,
sleep.
cholesterol, and blood sugar.
Okay.
You
So
can't
just-
you can't just take a cholesterol pill and your heart's magically healthy. I think it involves stress reduction, Dr. Steve. Sleep, hygiene, Dr. Steve.
Lord and lady, douchebag.
True, though.
Yeah.
True that.
Uh-huh.
True that. Now, this one is
God.
for...
This is not a morning zoo, you guys.
This one is just kind of for the morons out there.
The morons.
Worst habits for blood sugar.
Okay.
Okay. So carbs,
Eating cake.
stress, eating refined sugars, because it causes spikes in blood glucose levels, causing a stress response in the body, which causes a snowball of poor sleep, anxiety, and more.
Could I
And
eat-
more, not moi.
Could I eat apple pie if I got the
Oh, apple
sugar?
pie sounds so good right
If I
now.
got the sugar, could I eat apple pie? Because it sure is good taste.
Avoid desserts, white bread, white flour, sugary beverages, coffee with syrups or sugar, and high fructose corn syrup.
They say pi r squared, but that ain't right. Pi are round.
Oh my God, dad jokes. Dad jokes.
Oh, that's terrible.
I thought it wasn't a morning zoo.
Yeah, I was going to say he just added to it.
Doing the guy doing the weird character, and Scott making weird noises, and Tacie screaming "True Dat."
True Dad.
Maybe we could do a morning show.
I was going to say I think the
I don't think we're good enough for that.
No.
Oh,
God,
get
no.
out of here! Have you heard some of the shit that's out there?
it takes me a little while to get going in the morning. It'd be like a 10, 11 a.m. kind of.
Oh, they
show
just
for me.
yak, and they say, and they have the contest. Ooh, which topping do you like best on your ice cream? Call in, and we'll just go, shut the fuck up.
Who cares?
Yes,
Put
exactly.
whatever you want on your
Who cares?
Hot fudge or hot caramel.
or hot shit.
No, we're not doing this. That's the whole point. Is it's a hack, shitty bit. And
I was just
you two are
telling
over there going, "Well, wait a minute. I do like hot fudge."
Well, now that you mention it, Dr. T.
All right. All right. What else you got, Tace?
That's it.
Oh, that's
what
it?
else do you
Hey,
want me
very
to
good.
have?
Oh,
My
great.
God.
No.
Give thyself a bell.
Suck it.
No, those were good.
God's sakes. Just
All
because she did
right.
her homework, she gets a bell.
Number one thing,
Yeah.
don't take advice from some asshole on the radio.
That's exactly right, Dr. Scott. She did her homework, so she gets a bell. All right.
Hey, Dr. Steve, DMP Carissa, Scott, and Tacie.
DNP Caress will be back in, I think, 2 weeks.
Cool.
I think next week P.A. Letty will be here, and then DNP Caress will be back.
I have a two-parter here, and I'll let you pause between the two.
Okay. Well,
first
thank
off,
you.
Can you explain the difference between tolerance, dependency, and addiction?
Yeah. Is
And
that
then here's my second one.
okay? That's the first one.
Pause.
Sure. Well, I mean, any of us can talk about this. So, tolerance is just a phenomenon that, and it's not just applicable to opioids, but could be lots of other drugs. That over time you need an increasing amount of the drug to produce the same effect. And it is classically seen in opioid, analgesics, heroin, oxycodone, those things where you have to take increasing doses over time to still get the same effect. Now, there is a weird one, methadone, the D isomer of methadone. So methadone, it has a right-handed molecule and a left-handed molecule. It just has to do with how the molecules are made, and they're mirror images of each other. The D, the right-handed molecule, blocks a receptor called N-methyl D-aspartate. Don't worry about what that is. But when you antagonize that receptor, tolerance goes away. For some reason, the body continues to be responding to the same doses of medication. So we can throw D-methadone at people, and they stop, having to increase their opioid dose for their chronic pain. Okay. Or you can just use methadone. A lot of people I've had on methadone 5 milligrams 3 times a day for 10 years for neuropathic pain or whatever. So it's pretty interesting. So that's tolerance. Now, addiction is, there's medical definitions of it, but addicts tend to lie, cheat, and steal to get their medication. They take it for non-medical use, right? They take it beyond the point where it's doing them harm. And when they stop taking the drug, they will go through withdrawal if it's an opioid. Now, dependence is another thing. If you get somebody who has cancer and they've had cancer pain, you run up their dose of opioids over time, and then you cure their cancer and then they stop their medication. Now, they didn't lie, cheat, or steal. They were taking it for a medical purpose. They weren't taking it beyond the point it was causing them harm, and they didn't crave it. But what they did have was withdrawal because they stopped their medicine too quickly.
Is that habituation?
People use these words differently. Okay. I always called that habituation. Some people say habituation and addiction are synonymous, but dependency is the word that that's the distinction this person is making between dependence. That person is dependent on it, meaning that if they stop it suddenly, they'll go through withdrawal. So the answer to that is don't stop it suddenly. If you're a cancer patient, you're getting your medicine from a palliative medicine person, they should be tapering it. I'll taper people over 3 months sometimes. I don't care how long it takes, as long as we're going in the right direction and the patient gets a nice, soft landing, because they don't deserve, after going through cancer treatment and they get their cancer cured and they had horrible pain and now their pain is gone, they don't deserve to go through withdrawal. So I don't care how long it takes, as long as we're going in the right direction.
Yep.
Okay?
Totally agree.
All right. That was part one of his question. Questions, comments? Okay.
Nope.
All right.
I understand that addiction is in your genes, but why can't they study somebody like me who was on Valium for years and just stopped taking it one day, and Soma for years, just stopped taking it one day?
Yeah, I don't know, dude.
200 milligrams of Cadian twice a day and 85 milligrams of Oxycontin.
Okay, Cadian is a long-acting morphine. It's you just take it once a day. So he was taking, did he say 85 of Cadian?
I thought it said of Oxy.
No, okay, hang on.
And 85 milligrams of Oxycontin.
Okay, wait a minute. Oxycodone.
200 milligrams of Cadian twice.
Okay, twice a day? Wow.
Twice a day.
So he was taking 400 milligrams of extended-release morphine. That is 40 Lortab 10s, just to give everybody context. If I say 1,600 morphine milligram equivalents, nobody understands what I'm talking about except another pain person. But if I say that's equivalent to 160 Lortab 10s, everybody goes, oh, okay, I get that. Yeah. All right, so let's see. And then he was taking...
And 85 milligrams of Oxycontin throughout the day, and just stopped taking it one day.
So 85, let's say he was taking 90 milligrams of oxycodone. That's equivalent to 13 and a half Lortab 10s. So he was taking 53 and a half Lortab 10 equivalents during the day.
And I'm not saying that I didn't have physical symptoms of, shitting my brains out for a couple of days, but I never felt the need to want to take it again. Why can't they study my genes?
Well, they should. I think that's how we learn things, is you find the outliers that have a trait that you want, and you see why it is. Obviously, it's genetic because everything is, but he may have an enzyme or some receptor that allows him to start and stop these medications with impunity. Most people aren't like that.
Right.
I think they should study him.
Yeah,
he should write a letter to a university center that's doing research on addictionology and say, hey, you guys want to get my blood? See, get some...
Or your stool or whatever.
Yeah.
See if it's a gut microbiome thing
Right,
or
it could be.
Who knows?
Who the hell knows? They should study the hell out of this guy.
Yeah.
They should put a thing out, a bulletin out saying, if you're like that, come see us.
Yeah. Yeah, wouldn't that be incredible?
And then they need to confirm it. So they need to get them hepped up on opioids and then stop it suddenly and see what happens.
See if he shits his pants for 3 days, like he said.
Well, that is one of the symptoms is diarrhea.
Right. Yeah, but the interesting thing is his withdrawal symptoms were physical, but he didn't have the mental component of really wanting and breaking in and going back and going and starting them again.
I wonder what made him quit.
I wonder what is on all that stuff for in the first place.
But, chronic low back pain or something.
Yeah.
Didn't he say he was in an accident or something?
Maybe.
And, maybe he just didn't need it anymore.
Mm-hmm.
I'm a weirdo because, you've seen my back. I've posted it on the internet before. It is a nightmarish scenario. It looks like something straight out of Hellraiser. And the guy offered me opioids, and I was like, hell no.
Mm-hmm.
Mainly because I understood that that's a dead end. Opioids are a dead end for chronic non-malignant pain for the most part. Now, the chronic pain people out there that are on opioids, God bless you. I'm not saying that you don't need them. Some people do, but I knew it would be a dead end for me, and it is a dead end for a lot of people. And, I did non-opioid things, and I'm no longer crawling up the stairs like I was.
Well, you did interventional things other than just
I did.
opiates.
That's what I'm saying. But I did no opioids.
Right.
I did interventional stuff.
That you responded to, thankfully, yeah. 2
epidurals and 2 facet joint foraminal injections where they take a big old needle and a C-arm. A C-arm is basically an X-ray that you can move around in the central axis. And this guy, my doctor, is a genius, and he can move that C-arm around until he lines up all the holes that he wants to line up in your spine, because there's all kinds of little nooks and crannies. He can line them all up, and then he just takes a needle and puts it right in there, and you can watch the medicine go into
the
joint space and see that it's right there. It's right exactly where it needs to be. And when you get somebody like that, those kinds of shots really help. The first one lasted 6 weeks. The next one lasted a month, but the next 2 that he did, where he did the ones right at the nerve root, that was 2 years ago, I think, wasn't it, Tace?
It's been a while.
I lost my handicap placard, to my chagrin, to be honest with you. But it's good. I don't want to lose my integrity by using a handicap placard when I don't need it, but it was awfully tempting. But I lost it, and I was in my office one day, and this guy was in there with a shitty cane, and he was having trouble walking. I said, just hang on a second, and I went and got him my highfalutin fancy wood cane and gave it to him. He was really happy, and I was happy to be able to just give it away.
Yes.
So it can be done, and this guy did it too.
Yeah.
Whatever. And he got off of it easy. I just never got on it in the first place. Anyway, I'm not like Dr. Agus, who says, "Oh, no chronic back pain person needs medication." That's bullshit.
Well, because he hadn't seen some of the shit we've seen. Probably.
I know. Well, I don't know what the hell is up with him. He wrote this book where you just don't need. He's arguing that nobody needs any pain medicine for back pain. But I did physical therapy. I did the epidurals. I did. I took gabapentin, which turned the nerves down a little bit. You told me to get rid of that damn back. My inverter.
Yeah.
That was making it worse.
Yep,
it seemed like it made it better. So I bought an inversion table. And for me, as long as I was on it upside down, I felt pretty good. But as soon as I got up, it was just everything was just smashing back together again. Yep. So I gave it to Lady Diagnosis so she can deal with it.
Now she can deal with it.
All right. I think those things are really good for some people. Yes. And if you want to see what I'm talking about, go to stuff.drsteve.com and just scroll down.
The biggest mistake a lot of folks do with it, they just tilt it back too far. Where if you only go maybe 20 degrees max.
No, you see, that's the whole thing.
You were flipping upside down.
Oh, yeah. You want to. The whole thing is you got an inversion table you want to hang upside down.
Yeah, but you're overcooking it, old buddy.
Yeah, a little bit.
Just a little bit.
All right. Very good.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Sergeant and Mr. Smith, you're gonna love this house.
Bunk beds in a closet?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
Hi, my name's Mike. I've got this issue with wiping. I've got a question. About a year ago, I started having this problem where it seemed like I could never wipe enough. It was always greasy and muddy down there. It seemed like it was just, the wiping went on forever.
Yep.
So I started using like those rolls of blue shop towels to wipe, and I would spray them down with some rubbing alcohol. And it was the only thing that would give me a clean sensation down there.
Yeah.
So basically, I was wondering, like, is there a chance that I might be making this situation worse?
Yes.
Because it hasn't gotten any better.
Yes.
All it's doing is making me feel temporarily clean until the next bowel movement. And I'm wondering, like, am I, like, killing any bacteria that's, whose job is to, like, sop up the extra grease by using this alcohol? Or, and basically, should I stop doing this?
Yeah, you should. I'm going to finish his call here because there's a little bit more to it. But what he's doing is taking away the oils, essential moisture. Oils from the skin around his rectum. And I've seen people who did what he did, and they end up getting this thickened red skin in their ass crack that is, you can't even describe it as skin anymore. It's like plastic kind of. It gets so irritated. What he's doing is he's irritating it to the point where he's losing his natural defense in that area, and so there'll be chronic inflammation there over time. Let me see. And then I'm going to tell him what to do instead.
I don't know if this is good or not. I've never heard of anyone doing it, and I've never seen anything else about anyone else doing it. And I'm just wondering if I'm if this might have worked itself out if I hadn't.
No, it wouldn't have worked itself out. You probably have a hairy ass crack. And we've used this analogy before. Just imagine taking Vaseline and dumping it on a bare rug and then trying to wipe it up with newspaper. That's basically what you're doing when you're trying to get fecal matter out of the matted hair on your ass crack. And it's very difficult to get things clean down there. Plus, there may be some just a little bit still up in the rectum that's working its way out because we don't seem to evacuate completely in this country because we don't eat enough fiber. So first thing, eat more fiber. Second thing, drink more water. Third thing, Tacie, get a
bidet.
A bidet, very good. Okay.
Give thyself a bill.
Oh, wait a minute. No, that's cheap, man.
Yeah, get yourself a bidet. Now, I messaged him and said, get a bidet. He said, I'm on the road all the time. Won't work. Gotcha. Guess what?
What about the wipes?
Guess what? I'm not a fan of the wipes either because you're still rubbing against your ass crack. Get a portable bidet. Tacie makes one that is not mechanical. It's very cheap. It just looks like one of those douche bottles that you use after you deliver a baby. Mm-hmm. I don't like that one. I like the Blow, Bleaux. It's battery powered and it's small. You carry it with you. You fill it up. You fill up the reservoir with warm water before you sit down to defecate. And then you pop out this little arm on it. And after you're done, you stick it between your legs and you push the button and it bidets your ass. And then it will completely clean all of the debris and, as
the loose matter.
As Harrison Young said when I was on his show, all the grit. He says, I want some grit in there. It's like, I don't want grit in my ass crack. So, shit is water soluble. And if you will you put this thing between your legs, hit the button, and just go until all the water's gone. And then all you have to do is pat yourself dry. And if you get a Tacie bidet for your home, that one has enough power. You're basically giving yourself a mini enema if you aim it just right. Mm-hmm. And they're like $69. Go to stuff.drsteve.com and scroll down, and this stuff is there.
Yeah.
Okay. That is literally the answer. They do not have these problems in countries that have bidets in every bathroom. Mm-hmm. Mm-hmm. Now, some of them have the separate bidet. I don't want that. I don't want to get up with
a separate place you have to sit.
Yeah, it's next to the toilet, and you get up with shit on your ass, and then you go over and you sit on this other thing, and then turn it on. It seems weird to me. Now, maybe it's just because I'm not used to it, but it's wide open, so it looks to me like there would be stuff in the bottom of it when you're done. I don't want that. Just get the one that's attached to the bidet. Now, what Tacie and I did, we were such fans that we got the Moen, M-O-E-N, makes a bidet toilet seat. Mm-hmm. And don't get the one you got to plug into the wall unless you just have to have warm water. You get used to it. I kind of like the cold water, the regular temperature water.
Soothing.
Yeah, it is. And the Moen, it doesn't have the pressure that the Tacie does, but it is integrated into the toilet seat, and it's less likely if you lean on it or something to break.
Okay.
And we put it on every toilet in the house, even the guest bathroom downstairs. I don't know if anybody's ever used it. But we are bidet fans.
Yes.
I cannot stand to not have it now, so I take my Blow even when we go on vacation or when I go on my trips to, Rochester and stuff like that for the WATP stuff. I take it with me. All right?
All right.
Here we go. Let's try this one. Tace?
Hi, Dr. Steve. I have a question. I actually asked my doctor, the surgeon, about it, and he kind of just giggled at me.
Giggled?
Everyone in the office giggled. They laughed
when
I asked because I mentioned Grey's Anatomy, but I am having a total knee replacement.
Okay, if you mention Grey's Anatomy, no one's going to take you very seriously. That was the most unrealistic show when it came to medical training. Yeah. I mean, first thing, all the interns are like 40 years old. I mean, how old Ellen Pompeo? I don't know how old she is now, but she can't still be a resident. I mean, I haven't watched it in ages. And if I found a bunch of residents hanging around socializing in the room of a patient that was in a coma, number one, you don't just keep comatose patients in the hospital just on and on and on when they're not on life support. You remember that? There was that person that had a coma, and they would just go in there and socialize and stuff and flirt and stuff. They would all be fired.
Yes, you would rip them a new ass.
That is really it's disrespectful and unprofessional and not okay in any way. But anyway, so that might be why they giggled, but let's see why he brought it up.
Next Thursday, June 15th. And stupid as it sounds, I've watched an episode of Grey's Anatomy where this guy was having showing signs of he couldn't remember who he was, where he was.
Oh yeah,
like Alzheimer's or dementia, whichever. Anyway, this comes to at the end of the episode, it said it was a reaction to the cobalt that was in his knee. I asked the doctor, what is the what metal is in the knee I'm getting to be made up, and he said cobalt. And I said, I saw on Grey's Anatomy that cobalt, people have an allergic reaction to it that kind of looks like Alzheimer's. And they just giggled. They didn't really answer my question.
Yeah, I know.
So is it true that people do get allergic or are allergic to cobalt, and it does cause symptoms like that? And
okay, listen. Listen, I don't know from cobalt. Memory loss is a complication for many people after total joint replacement surgery, and it is. I'm looking at JAMA Network right now, long-term cognitive trajectory after total joint arthroplasty. People have poor concentration, impaired attention, or executive function. And, but these tend to be people that are 80.
And from the anesthesia, not from the joint or from some kind of allergic reaction.
Is there cobalt in titanium?
So I was going to say, I'll let you finish, but I'll talk.
Yeah, no, go ahead. I'm done. Fuck, I don't know.
Yeah, so I have seen a number of folks that have been allergic to different kind of total joints and infusions, which it could be cobalt, it could be the titanium, it could be nickel, whatever it is. Well, but I've seen it in everything from the neck, from like ACDF. So when somebody has a fusion in their neck, to having actual total knees completely redone, taken out and put in a new type of knee.
Yes, yeah, I've seen that.
Yeah, but that has nothing to do with the memory. The memory thing is typically associated with older adults in the anesthesia.
I mean, the cobalt's in all kinds of stuff.
Oh yeah.
And apparently 1 in 20 people in the United States or worldwide are allergic to cobalt. But it's in all kinds of environmental stuff, So I don't. It's interesting. Yeah, it's people with cobalt allergy have allergy to nickel and chromium, which are closely related, and 15% of people are allergic to these metal allergens. But that's crazy. It can be cobalt isn't responsible in part for production of B12, so that maybe they end up with a B12 deficiency. I don't know. I don't know what the hell Grey's Anatomy was talking about. I'll just tell you about Google Grey's Anatomy cobalt allergy and just see if anything interesting comes up, because that is a very strange one. But I do know that a lot of those shows will go, and House would do this too. They would go for a very, they would find something that was insanely rare and then make a whole show about it. So we'll come back to that one.
Yep.
All right. Let's try this one.
Hey, Dr. Steve. I've been listening for a while since my husband got me hooked on your show, but calling for the first time.
Excellent.
So I have a question about allergies. I'm a 38-year-old, and I have been a long-time allergy sufferer, pretty much my whole life. Basically, everything environmental that blooms in every season here where I live in Alabama. Dust, mold, if it's got fur or some kind of dander, I'm allergic to it.
Oh, my God.
I started allergy shots last year, but I'm also taking over-the-counter medications on bad days. And so bad days, if I have an attack, it's, the sneezing, itchy, watery eyes, itchy face. And Benadryl is the only thing that gives me immediate relief, but
Lord.
it knocks me out even if I just take like a half.
Yeah.
And so I'm wondering if you knew of anything that might work just as powerfully as Benadryl, but doesn't make me fall asleep as soon as I take it. I appreciate you and Dr. Scott so much. Take care.
But not Tacie, though.
No. Because she likes that those briars.
Yeah, so I'll talk about allopathic stuff, and you can talk about non-allopathic stuff.
Sounds good.
Number one, go get yourself a Navage. The Navage is a saline nasal a nasal irrigator. Tacie has one, and I bought her one when she was desperate, and it was a win because, you tell them.
I could breathe after, and it felt like concrete in my head.
Yeah.
But I could breathe after I did it.
It washes out the allergen, so you quit making that allergen and, histamine release so that you have to take an antihistamine. That's what Benadryl is. The problem with Benadryl is it is also highly what we call anticholinergic, and it doesn't matter so much for this show what that means, but what it does is it gives you dry mouth, it makes you sleepy, and it increases your risk of dementia long term too if you take it every day. So we're not big fans of the anticholinergic stuff, and if you're an elderly male and you take Benadryl, it can cause you to not be able to urinate. So I recommend the non-drowsy antihistamines.
She didn't mention Monty Luke has.
You're
so
right.
She's not tried that.
That was where
Give thyself a bell.
Oh, did you hear that, Scott?
Oh, for God's sake.
That's where I was going.
That's what I get for missing a week.
So the over-the-counter stuff, Navage, Flonase,
yes,
nasal steroids. You can get Dr. Scott's nasal rinse. It has, and you can get that at simplyherbals.net. Seriously, he has two of them, one with CBD, one without, but it has peppermint oil in it, which is a direct anti-inflammatory for mucous membranes. You can do all of those things, and if that doesn't do, a non-drowsy antihistamine like fexofenadine, which is sold under the brand name Allegra, and Flonase, which is fluticasone, is a nasal steroid. If that doesn't do it, then your prescriber might be able to write you Montelukast, which is what Tacie was alluding to. It's also known as Singular.
Gotcha.
And for some people, if it works, it's like magic.
Okay.
If it doesn't work, it just doesn't work. But for the people that does work on it, it's great. Now, be careful. I've prescribed that stuff for probably 35 years, and we had one case of a kid who was put on it, and it was a friend of ours who they thought he was autistic, and he didn't connect, and he didn't, he threw fits and all this kind of stuff, and they really thought he was autistic. They, at some point, I'm not even sure how they came to this, but he'd been on Montelukast his whole life.
Okay.
They took him off of it, and all of a sudden his developmental delay just went away.
Wow.
Now, he was delayed because it was delayed,
Sure.
But he's moving so much faster and getting, basically a normal kid now.
Mm-hmm.
So be careful with all prescription medications and just be aware of the adverse effects. That's a 1 in some X thousand where people have a problem with that. But we see crazy things with some antibiotics.
Yes.
The fluoroquinolones, like Levaquin, people just throw those out for this, that, and the other. And every once in a while, I had a friend who went psychotic.
Oh, wow.
And it took them a minute to figure out it was the fluoroquinolone that they were taking. They just thought that they'd gone crazy and paranoid and hearing voices and, threatening people and stuff like that. Stopped the antibiotic and went away. Now, what's the other weird one, Scott? You should know this with Levaquin or fluoroquinolones.
Tearing Achilles tendons.
Ooh.
Give thyself a bell.
Did you get one?
That is true.
I'm 10 behind now.
Yeah, you can. It can somehow weaken the Achilles tendon, and people have been known to be taking that antibiotic and get a rupture of their the tendon in their ankle, so the back of their ankle. All right.
Yep.
Very good. Try that stuff and let us know.
Let me tell her real quick a couple other things.
Oh, yeah, I'm sorry.
No,
Go ahead.
it's okay. It's okay. Yeah.
Strangle us.
No, and I'm with Dr. Steve, first of all. Try to wash the crud out of your head. I like the Navage. I love the Simply Herbals nasal spray. The other thing is, in Chinese herbology, we have some really wonderful medications that work extremely well for allergies, which is what I take. And one of them is called Xanthium. Just find somebody that practices
Xanthium.
Chinese. Yeah. It's just a flower. But it's a mixture of other herbs, and it works extremely well for allergies with no side effects. Doesn't make you drowsy. Just find somebody that does some herbal medicines in your area. They may have some kind of magic elixir.
Magic. Well, we don't like magic, but
hey, listen, if it makes those allergies better, you take whatever you can take.
That's true. That's right.
But and sadly, the other thing is sometimes people just have to move to a less pollen-filled environment.
Yeah.
She might have to move to the beach.
When I go to the beach, my allergies go away.
Magically disappear.
Yeah.
Gosh, wonder how that happens.
Yeah. Well, you're washing your
I
sinuses out. No, but I mean,
and salt, the salt water air.
When you
and
get in there in the wind, the wind at the
breeze.
beach also keeps stuff. Seems to just keep you from inhaling antigens because the breeze tends to come from over the water.
Yep.
Do we know why that happens? Why is there always a wind at the beach?
Because there's no trees to block them.
Nah, bullshit. Shit. Now, when
it's called the trade wind.
That is part of it, though. So I'll give you some credit for that. But you have heat rising over the sand. I mean, heat. Heating the air over the sand, and so that air rises, and as it rises, it's got to be replaced by air from somewhere else, so the cooler air over the ocean will take its place, and so you'll get wind that generally comes from the direction of the ocean. That's why you can always fly your kite behind where you're sitting.
And that's our geography lesson for the day.
Well, that would be
the ocean does
meteorology
lesson.
Oh, would it now?
Yes.
All right, let's see. Here's a good one.
Hi, Dr. Steve. I have a question that does not involve COVID, dicks, or balls.
Oh, okay. Next.
Don't want to hear it.
Next question.
I find myself allergic to just about every antibiotic there is, and I'm starting to get a little nervous about it. I have anaphylactic reactions with both penicillin and cephalosporin drugs. The deoxycycline gives me a terrible migraine, and one of my go-tos, which would be like the Z-Pack, recently I had a terrible adverse reaction to that, even though I had taken it in the past. So my question is, as a doctor, what would you do with a patient like me?
Okay, we're running out of time, but I can tell you exactly what I would do. If you had let's just say you had Acinetobacter, infection in your bowel, and the only thing that would treat it is penicillin. We would do a desensitization protocol on you. There is a specific protocol where you basically give somebody a little bit, then you give them a little bit more, and what you're doing is you're eating up all those antibodies, the IgE antibodies that cause anaphylaxis, and you're eating them up in small doses, and you keep increasing and increasing. It takes several hours to do. And then I would give you the antibiotic, and I could give you the antibiotic as long as you don't stop it, you can continue to take it. This doesn't cure your allergy. It just allows you to take the antibiotic in an emergency situation. Gotcha. And then if you take it, let's say for a month, then you go off of it for 2 days, you're going to have anaphylaxis again. So that part, we don't have the ability to fix just yet, but we can desensitize you. So if you get something that's horrendous that has to be treated with one of those antibiotics, then we can do that. Now, as far as the scary stuff, there are other types of drugs. There are meropenem, there's aminoglycosides, there's all kinds of different classes of drugs that you probably can take. You just haven't because they are IV only. And yeah, if you get a cold, you're going to be one of the good patients that says, I don't want an antibiotic for this, because antibiotics don't treat colds. They treat bacteria, and most people who get antibiotics for an upper respiratory infection actually don't need them. So that's good. You won't be contributing to antibiotic resistance and all that kind of BS. All right?
All right.
Well, anyway, what have we done today? We talked about allergies. We talked about cobalt allergy,
a lot of
desensitization.
Yeah, a lot of allergies.
Tacie's time of topics.
That's right.
We've done it all.
Greasy ass, baby.
And greasy ass, yeah, bidets. Get a bidet. Go to drsteve.com or stuff.drsteve.com and pick yourself out a bidet. All right, and before we get out of here, Dr. Scott, you had a question from the fluid family.
Right. Yes, this is from Mark. Mark wants to know why is my body resistant to all pain medications, including narcotics and opioids? Tried every possible one. Terrible sciatica pain with no relief possible. Waiting for an MRI.
Okay. I have an answer for that. Number one, everybody's different. But number two, some pains are not opioid sensitive.
Right.
And what I don't know if they started on, say, hydrocodone 5 and then went, let's go to oxycodone 5 and then let's go to hydromorphone 2. Right. I see this a lot. This is sort of a bullshit approach to pain where some of my colleagues will just rotate people to different low-dose medications and wonder why they don't work.
It's just not enough.
Yeah, right. It's just not enough. But low back pain, particularly sciatica pain, tends to be neuropathic pain. It's caused by a pinched nerve in the back. And
Discogenic, yes.
Opioids are really not great for that.
No.
And they're just different pains that, vulvar pain is not very sensitive to opioids. Mm-hmm. So, there are just some that don't work, and so we need to do something else. Once you,
well, I was going to say after an MRI to rule out anything really, kind of ugly. What we like to do is a couple things: A, ice. B, heat, something else from the exterior that might help a little bit. TENS units can help, certainly. Acupuncturists can help a little bit. But the next step is going to probably be an epidural.
Yep.
And
Tell them what that is.
That's why it's so important.
Because we talked about it earlier. But
it's so vital to get an MRI. In order to have an epidural or a facet, an epidural, they're going to take a big needle and run a steroid into the spinal canal, and they're going to. And what that does is that kind of lines the inner column of the spinal canal with steroids and reduces the swelling inside.
Yeah, so they don't actually go into where the spinal fluid is. That's why it's epidural. Yeah, you're going around the dura, but you're getting very close.
Yeah, I would say you don't actually puncture the dura and go into the
That's
corner.
Right.
So,
yeah,
it's in the canal. But and what they'll do in a lot of cases, especially because sciatica is a very complicated thing sometimes. But if it's a discogenic sciatica and you have like a complete failure of a disc, you're going to need a steroid probably that might help some, and maybe some gabapentin, like I would assume you were going to say, which may help some with the neuropathic pain. But in a lot of cases, physical therapy and some traction sometimes, and even sometimes those little tables can help. But if it's bad enough, sometimes the only treatment is going to be some sort of a surgery, some kind of surgical intervention. Whereas if it's more of a stenosis, just a narrowing of the canal, the steroids might help wonderfully well. So maybe it's just was not the right medication, right approach.
Right.
Not because somebody did something wrong.
I had all of the above.
Yeah, they need your MRI.
I have spondylolisthesis, which means that the vertebral bodies are not stacked on top of each other properly. And when they're not, when the one is kind of offset, 50%,
shifted forward typically. Yeah.
Right, then all of the little holes where the nerves are supposed to go through are made more narrow.
Mm-hmm.
And the crazy thing is, the body can adjust to that if you give it time. And the steroids helped to decrease the swelling around there, so it took off the pressure. But my body just had to eventually just adjust to this. And now I have pain every day, and my foot is numb a lot of times, but it doesn't affect my quality of life. I can sit and watch a movie, I can walk. I feel like right now I could go to Disney World and walk like we used to do, 8-10 miles a day without any trouble. I might have to sit down more, but I'm back to walking in the hospital faster than my interns can keep up with me. It's like, why walk slow? We got shit to do.
Yeah.
Anyway.
Get it going.
All right, you got anything else?
That's all.
That's a good one.
Yeah,
I hope you feel better, man.
Yeah.
And keep us in the loop,
Yeah.
okay? Let us know how you're doing, for real. Many thanks go to Dr. Scott. And how about some thanks to Tacie as well?
Yeah.
Yeah, appreciate you. You won on the bell thing today.
I did win.
Thanks to everyone who made the show happen over the years and listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website, drsteve.com, for schedules, podcasts, and other crap. And don't forget stuff.drsteve.com and simplyherbals.net for all of your online shopping needs. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye.
Bye, guys.